Picture this, it's Tuesday night, your kid has a school form due, and you realize they still need a vaccine. You try calling your doctor's office, you get a voicemail, the walk-in clinic, well, it's a 2-hour late, and suddenly a simple health task turns into an all-day problem. So here's a shift. Ontario is expanding what pharmacists and other healthcare professionals can do, so care is closer, faster, and more convenient. Starting July 1st of 2026, pharmacists across Ontario will now be able to give additional publicly funded vaccines, the kind that used to require a doctor visit. Think things like tetanus shots, things like pertussis, diphtheria, RSV, and shingles. Meaning that instead of rearranging your life around a clinic appointment, you may be able to walk into a pharmacy and get protected right in your neighborhood. And it doesn't stop at vaccines. Also beginning July 2026, pharmacists will also be able to assess and prescribe for 9 more common ailments, the everyday issues that still steal your time and comfort. Those include calluses and corns, dandruff, dry eyes, head lice, jock itch, mild headaches, nasal congestions, ringworms, and warts. That's great. You can think about how many times something minor still forces you to take time off work, miss class, or sit in the waiting room. This is about turning pharmacies into a one-stop option for everyday care using health professionals like pharmacists to their full extent of their training. Ontario says this expansion is meant to improve access and reduce pressure on the healthcare system, especially when emergency rooms and primary care are so stretched. And don't forget, there's proof that this model is already working. We've been doing this since 2023. Pharmacies have already delivered over 2.4 million common ailment assessments for the earlier list of condition. And even more, the provincial plans are to add even more 5 additional ailments for early 2027, expanding the total list to 33 minor ailments. And pharmacists are not the only ones that were in focus now. Ontario is also directing regulatory college of other healthcare professions like optometrists and physiotherapists to develop frameworks to expand their scope of practice even further. That will include also the chiropractors, dental hygienists, denturists, audiologists, and speech-language pathologists. Because the goal is simple, my friends: more capacity across the system and faster access, including for rural, northern, indigenous, and underserved communities. So what should you do next? If you're in Ontario, mark July 26th, Canada Day, as the turning point, and ask your local pharmacy what services they'll be offering as these changes roll out. My name is Alex, Mr. Pharmacist in downtown Toronto. If you found this information helpful, share this video with somebody who's tired of long waits for simple care, and follow for clear updates and what this means for your everyday health. Stay healthy, everyone.